Hey, so when it comes to connecting your arms to your shoulders through your chest, it can be quite challenging because we have all this connective tissue goes from one side to the other and then all the way through the rest of the body. And sometimes, we have pain in certain areas, but it's actually somewhere else that's triggering it or the cause of it. So sometimes just treating the symptoms can be challenging because your actual cause of that sensation may be somewhere completely different. So one of the things you can do to help mitigate some of that transference is to open up space in your body to, for instance, for your chest area and your shoulders. A lot of people say, roll your shoulders back, open up, but then you're pinching the back. So you're actually not aligning yourself properly. If you want to open up your chest, you actually want to pull to the side. You want to go sideways. You want to almost like pull your shoulders away from your midsection. So you're not pinching the back, you're not pulling backwards, you're pulling sideways. And that can be a little challenging if you've never done it before. Sometimes it helps to put your hands on your hips and just try and pull your elbows out, maybe wiggle a little bit, but you're trying to open this up without pinching the back. And you're also opening the back at the same time. When you get it, you'll know you got it. Just play around with it. This is an odd one. It doesn't get talked about a lot, but it is really helpful in opening up the whole chest and rib area without pinching other areas as you go. And then from there, one of the ways people also talk about the shoulder alignment. This is one of the tricks I learned from a therapist, is you put your thumbs up and facing forward. Start with your hands at your thighs. I know it's out of frame. I just don't have a long enough cord so I can actually have myself recorded while talking. So excuse that. But put your thumbs forward at your thigh and then lift your arms up as tall as you can go and then bring them down to the side and then relax about 10%. And then this will help align your shoulders where your ideal posture might be. Now, this could vary from person to person, but this is a good way to help you feel how it might be different from how you would normally stand. I know I slouch. I've been working on that for years, and it's gotten better in myself. But this is also why I got into learning about the body and how to be able to modify these things within myself, with also, of course, the help of other body workers. But what you do in your day-to-day makes the biggest difference, because you can only see somebody maybe once a week if you're lucky, once a month, or even just a couple times a year. So what you're able to do for yourself makes the biggest changes. And it also helps to prepare you for when you do see somebody and are able to relax and really absorb the treatment.